Hi, I'm Gordon Lang. I'm a nurse practitioner at the Urology Team here in Austin, Texas. A nurse practitioner is a registered nurse with a master's degree. That extra education and training allows us to prescribe and diagnose and perform procedures here in the office. I grew up in the Midwest and I went to nursing school at Indiana University. After graduating from nursing school, I moved out to Washington, D.C., where I worked at Georgetown University Hospital as a registered nurse. I then went back to grad school at Georgetown and got my Master's of Science in Nursing, and then became board certified as a family nurse practitioner. After that, I moved down to Texas because all my family lives here in Texas and I wanted to be somewhere a little warmer. Before I went back to grad school, I was working as a nurse in the hospital, and I really enjoyed that, but I was taking care of very sick people, and I would work for a few days in a row and then I'd have a few days off, and I'd come back to work and the patients that I was taking care of would be gone, and I didn't know what happened to them. Were they transferred? Were they discharged? So I wanted to work in an environment where I could form long-term and long-lasting relationships with my patients. And going back to grad school to become a nurse practitioner seemed like a good fit. I started working for the Urology Team in the fall of 2015, working primarily for Dr. Eric Giesler as his nurse practitioner in both the Westlake and the Jollyville locations. One of my roles here is to assist Dr. Giesler in the Advanced Prostate Cancer Clinic. Advanced prostate cancer usually occurs when people undergo treatment for prostate cancer and the treatment either fails or the disease recurs and progresses. We offer a wide variety of treatment options that historically weren't offered in the urology practice setting, so we're fortunate to be able to continue caring for these patients with advanced disease. I think my care philosophy as a nurse practitioner stems back to what I learned as a registered nurse. You treat every patient individually and holistically. You don't focus in singularly on their one urologic issue. You look at their social issues and anything else that could be impacting their health. And you want to approach every issue from an individual standpoint. Every patient's different, and even though the diagnosis is the same, how you approach it and how you evaluate it in that patient could be completely different. What I like best about being a nurse practitioner is I feel like I'm able to bridge the gap between a nurse and a provider, because at the same time I'm both. What I like most about working at the Urology Team is that we're a very progressive practice. We're early to adopt new medications and new procedures into our practice. So from the time a pill or a procedure is approved by the FDA and all the research is completed, it's a very short time frame until we offer it or we can prescribe it to our patients.